Hi, welcome back to The Wellness Abode. My name is Evan Esquera.
And I'm Dr. Melissa Esquera, and today we're going to talk to you about natural ways that you can support your body if you struggle with celiac disease.
We have a lot to cover, so let's just get straight into it. And our first question is, what is celiac disease?
So celiac disease is an autoimmune disorder where the immune system in the digestive tract sees gluten and it starts to attack the body's intestinal tissue.
And our next question, how do we know we have celiac disease? What are the symptoms?
Okay, well, symptoms would be digestive issues, digestive discomfort, things like bloating, diarrhea, constipation, abdominal pain and discomfort, nausea, vomiting, and fatigue. To get an official diagnosis of celiac, your doctors will usually run a blood test, but truly, in order to really get that diagnosis, they'll usually have to do a biopsy on the intestinal tissue to see if you have celiac. That's how you get the official diagnosis. A lot of people can derive that they may have celiac disease between figuring out the correlation of ingesting gluten-containing foods like breads, flours, cookies, cakes, pastries, things that are pastas, things that contain gluten, and then the activation of those symptoms. Now, obviously we're talking about celiac disease today, but just because you haven't been diagnosed with the autoimmune component of gluten sensitivity, celiac, which is on one end of the spectrum, doesn't mean that you don't fall somewhere else along the spectrum of sensitivity to gluten. A lot of people have sensitivities to gluten, and it might not necessarily be because of the wheat itself, but it's more so because of all the technological advances that have happened in the world of agriculture and farming, where they have done a lot of cross-hybridizing of the wheat, and it's our immune system that doesn't necessarily recognize wheat as it was even a couple of hundred years ago. And that's why we see so many people today with celiac disease or somewhere along that spectrum of gluten sensitivity.
We touched a little bit on the foods that trigger celiac disease, but what are some alternatives to wheat?
A lot of people, they go to the grocery store when they realize they have a gluten sensitivity and they try to buy all these like gluten-free substitutions, like gluten-free bread, gluten-free English muffins, gluten-free pasta. And sure, you might find yourself able to go down that route, but in the world of functional medicine, something that we've really come to understand over the past 25 years is there is this level of cross-reactivity that can happen once you've developed a gluten sensitivity. It often means that you might also be developing sensitivities towards other grains that kind of look like gluten. And so I usually tell people, stick with very simple gluten-free grains like rice or quinoa, but you'd really be better off avoiding most grains altogether until you can get some type of lab test that would show you exactly what grains, aside from gluten, you might be sensitive to. So things that you could do, like simple swaps, because I know that that can be like mind-blowing for people avoiding grain, but if you have celiac, it might really work in your benefit to avoid it altogether, but leaning in towards nice, healthy, starchy vegetables that can also leave you satisfied and not feeling hungry. I think that's what a lot of us really get tripped out about is of like not eating things that usually fill us up like the breads and the pastas. So things like potatoes, sweet potatoes, red potatoes, russet potatoes, all of those things. You can also do lots of like chickpeas and lean into soaked lentils, soaked beans. These things can leave us very satiated, help us stay fuller longer, and also avoid the possibility of cross-reactivities taking place where you still might not feel digestively healthy even though you've been avoiding gluten.
Our next question is, what does celiac disease do to a person?
Well, as your immune system is seeing the gluten come in, it's activating that autoimmune response. Auto meaning self-immune. So your immune system starts to attack your own small intestine tissue. And this happens whether you're autoimmune celiac or if you have a gluten sensitivity, this same physiological response could be happening, but just at a less intense degree. So your immune system starts to attack the tissue of the small intestine, and it does start to affect over time how your intestines absorb food. So the immune system starts to damage the little hairs, the little cilia on the intestinal wall, and that really does affect how you start to absorb and manage nutrition coming in from your food over time.
So is this the same thing as leaky gut?
So celiac and leaky gut are not the same thing necessarily, but celiac or gluten sensitivity being reactivated over and over again does cause leaky gut over time.
And our last question, what can we do to support our body to deal with celiac disease naturally?
So of course we can use essential oils to help manage and also help even support the regeneration of some of the damaged tissue that might have developed as a result of the immune system attacking the intestinal tract, whether it be in a fashion of autoimmune activity like in celiac or in a lesser degree like gluten sensitivity. So there's lots of essential oils that we know can support healthy regeneration, but I also think it's important to include essential oils that we know can help to dampen an autoimmune response. And so oils like frankincense and myrrh are really important to include. Not everybody likes to take myrrh internally, although I think it's really amazing. And so I'm gonna give you guys the tincture that makes the most sense coming from me, a functional medicine doctor in practice, and one that we've recommended to several patients with great results in terms of they start to feel better, their intestines feel better, and I know ultimately it's a result of soothing that autoimmune response, but also supporting the tissues in regenerating and getting back to a place of healthy mucosa and proper reabsorption. So in our blend, we have frankincense, we have myrrh, we have turmeric to address inflammation. Squelching inflammation is always important when we're looking at regenerating tissue that's been damaged over time. And then also copaiba, because copaiba helps the body to adapt appropriately. So if your immune system's been in a state of hyper-responsiveness or gotten tired and stopped responding appropriately, copaiba is a great adaptogenic oil. And copaiba can kind of act a little bit like a natural antihistamine. Of course, it's not a replacement for anything you would buy at the grocery store, at the pharmacy. But why that matters is because we know that when there's a hyperhistamine response, which can happen when there's chronic degradation and immune system activation in the intestinal tract, we know that you can be more vulnerable to developing other issues that can, it can affect your detoxification pathways. It can make you more vulnerable to allergies in the sinuses and out there with the environment. So copaiba just makes a ton of sense to include in a blend when we're trying to support tissue regeneration in the gut and also soothing and calming the autoimmune response that might be happening with a celiac patient.
So those essential oils are frankincense, myrrh, turmeric, copaiba. How do we take those?
Good question. So it's super easy to make this blend up. I know that's quite a bit of oils. So it's taking a 1 ounce dropper bottle, kind of eyeballing it, or maybe you need to take like a ruler and figure out exactly what that would be if you divided it up into 5 parts, and you just include equal parts of each oil into that 1 ounce dropper bottle. Make sure you give it a good shake before you use it. You could seriously just apply that blend topically if you don't want to take it internally. I would do 3 to 5 drops in my hand and then rub it onto the belly. You want to make sure that you get it around the belly button. Get it right there in the middle of the abdomen because your intestinal tract is quite large, and we know that we've got a lot of reflex points that intersect right here in the middle, so it's a great place to apply it topically. But I'm a big advocate for using the oils internally in this case, and so you could take that blend and do 3 to 8 drops in a veggie cap and just take it 2 to 3 times per day. I would start with 3 drops and then work your way up to 6 or even 8 drops with each veggie cap.
We also suggest that you take Terrazyme with every meal.
So it's really hard if you're going out to eat at a restaurant to totally avoid gluten. Sometimes these food particles can get mixed up, even if it says gluten-free. If they're cooking something containing gluten on the same platform as like a gluten-free product, you might get some gluten contamination. I mean, I have a lot of patients who refer to this as gluten poisoning because literally when they're celiac, they really do feel like they've been poisoned. And of course, the enzyme, the Terrazyme, isn't going to completely counteract that exposure, but that Terrazyme is a unique enzyme blend because it does have the enzyme that your body needs to break down gluten more appropriately.
And so if you like this video, we have a lot more videos just like this in our brand new app. The app is called The Wellness Abode, and you can find it in the Apple Store if you have an iPhone and the Google Play Store if you have an Android phone.
And if you'd like to learn about functional medicine, essential oils, and natural living, be sure to hit the subscribe button. We get 1 video out per week.
That's it for today. Thank you for visiting The Wellness Abode.
Just cut it, that's fine.